So I'm trying to look at a consideration, and this is a factor that you should consider if you want to actually advise a patient on which type of drug they should get or use for a particular health condition. So this is you trying to look at the quantity of drugs the patient will require in a cost-effective manner. Do you understand? How much will this drug, how much will the patient, like what type of drug will the patient even require? Like, what's the quantity? And you are trying to look at the financial status of this patient. You are trying to put the patient first, and you are trying to ensure that this patient is getting the best drug for that particular condition, okay, at the lowest rate. Okay, so this concept is just trying to you are trying to look at several things to make this decision. So you are looking at the patient's population. Okay, it's not a one patient. Let's say you are dealing with a community, right? So you look at the patient population, you look at the numbers of people in that particular population that will need the treatment. You look at their age, you look at their weight, you look at their comorbidities that will affect the dosage. You define the standard treatment protocols. Then you now work out the recommended dosage per patient. How much would they be taking daily? How many dosage, or what's the quantity they'll be taking weekly? Or then look at how long they'll be taking the drug. So you now calculate the total drug requirement. Okay, so this is a formula. All right, this is a formula for you trying to look at the quantity of drugs that a particular group of patients will be needing. Okay, looking at the cost effects. So let's say if you have 100 patients that will need 500 milligrams of, let's say, paracetamol per day for 30 days. Okay, this is you trying to calculate the total grams or milligrams. So the formula is number of patients multiplied by the dose per patient multiplied by duration. Just a linear equation even. So cost ineffectiveness is now, you now compare the different brands. Different countries will make different companies will make the same drugs, give it different names. So you are trying to look at which country is which company, I'm not only saying country, which company is producing the best brand, the most effective, and the cost is relatively cheap. So you look at which company is giving you the best discounts. Then you work with your formula so that you stock just within the range of what those people need to avoid overstocking or avoid understocking. So adjust for real world variabilities. You look at patient adherence, then wastages during dispensing. So you're actually looking like not all the patients will even stick to your advices when you give them. Then you also look at getting a small reserve at least. So cost-effective strategies: use generics when where possible, centralize procurement to negotiate better prices, forecast tools, and regular audits to match supply. So you always be checking your data again, always updating it so that you're always correct about your calculations.